Welcome and thank you for watching. This short video will be referencing new research underway at Ochsner Health involving the Do No Harm Healthcare Matrix. It is within the context of proposed guidelines for the use of race in clinical notes. What is the Do No Harm Healthcare Matrix? While the phrase do no harm is often interpreted as avoiding interventions that cause direct and intentional harm to patients, the phrase can also be interpreted as the principle of avoiding practices that cause indirect harm to patients. This is often done without malicious intent. Within the Do No Harm Healthcare Matrix, the language medical providers use in their documentation is a source of scrutiny. If inappropriate, stigmatizing, or condescending language is used in notes, it can perpetuate bias, reinforce health disparities, and undermine trust in the patient-provider relationship. This is especially true when patients are able to see provider notes, or notes are viewed by other healthcare providers. If inappropriate language is used, other healthcare providers may form inappropriate generalizations about patients even before they are introduced. The use of race in clinical notes. Specifically looked at here is the use of race in clinical documentation. There are many EMR templates that automatically fill in a patient's race, and there's EMR templates that may ask for providers to provide the patient's race from a drop-down list. Furthermore, doctors may manually include the race of patients without using an EMR template. Our team is currently conducting research at Ochsner Health and has so far found that 50% of clinical notes at Ochsner contain the mention of race in the HPI or Chief Complaint section. This can be viewed as problematic because it is often in the context where providing information regarding race has no or little clinical relevance. It can only serve to harm patients unintentionally. Furthermore, this ongoing research has shown instances where the documented race does not match the self-reported race of the patient. Research has shown that race-based descriptors in clinical notes can influence patient care and clinician perceptions. It can also disproportionately affect patients of minority status. Our research is primarily focused on the proposal of recommendations on the appropriate way for healthcare providers to document race in clinical notes. The first recommendation is to contextualize race rather than defaulting to it. Race should be included only when it is clinically relevant and contextualized. Remember, race is a poor proxy for genetic or biological traits. The use of skin tone or other outward appearances of a patient often has little to no relevance when trying to group a patient based on their genetic similarities. The second recommendation is to use patient-identified race and ethnicity when available. The race and ethnicity should be reported by the patient, not assumed by the clinician. Use official, standardized categories when necessary. Examples of these are the categories used in the US CDI guidelines. Stigmatizing or stereotypical language should be avoided. Refrain from terms like non-compliant or aggressive without context. Replace with objective, behavior-based descriptions. Transparency and shared understanding should be promoted. Recognize that patients now read their notes. Language should foster trust, not alienation. Inclusive language should be preferenced. Social determinants of health and intersectionality should be integrated. When race is mentioned, consider including relevant social determinants of health to provide a fuller clinical picture. Educate and audit. Clinicians should be trained on the ethical and clinical implications of race-based documentation. Implement regular audits of clinical notes to identify and address bias. In conclusion, if providers wish to incorporate race into clinical documentation, it must be done with intention. These proposed guidelines offer a path forward for clinicians and health systems to align documentations with the do no harm ethos, ensuring that the words we write heal rather than harm.